All right, we're going to finish up the electrolytes with phosphate. And normal phosphate is 1.7 to 2.6. Causes of low phosphate are going to be chronic diarrhea, chronic alcoholism, malabsorption syndromes. And how does this manifest itself? Is that we need phosphate for energy. We know ATP is an energy source, an active transport. So with no energy, we've got diminished reflexes, we've got muscle weakness, and it can lead to coma if the phosphate's low enough. How are we going to manage it? Well, we have a low amount. We're going to give it. We're going to give it orally, IV, or through IV hyperalimentation, which is a lot of electrolytes given together. Hyperalimentation is like you're feeding the patient peripherally. And then parenteral nutrition is the same thing. It's in the IV. Hyperphosphate, what are we doing? It's greater than 2.6. And why do we have too much phosphate in the blood? Well, we have too much of all the electrolytes in the blood when we have a renal failure or kidney failure, excessive intake of laxatives and enemas, manifestations, increased neuromuscular functions, impact on skeletal muscles similar to hypocalcemia. Management, we're going to treat calcium deficits, dialysis if we have too much, and pain in joints. Both calcium and phosphate have an inverse relationship. So if we have too much phosphate, we're going to have not enough calcium. Inverse means opposite. Hypocalcemia mimics hyperphosphate symptoms. Balance of calcium and phosphorus occurs at the kidney level, and that's why, again, if you have a kidney problem, you're going to have a problem with calcium, phosphorus, potassium, sodium, all of it. Magnesium enhances calcium actions within the cell and can mimic hypercalcium. So with all of this, if I haven't confused you enough, what do you really need to know about fluid and electrolytes in nursing? Well, plenty. You need to know the levels of these ions and cations of potassium, sodium, chloride, magnesium, calcium, and phosphorus. Again, normal lab values, hypo and hypertonic fluids. Physiologic actions of the electrolytes in the body. How do they work? What do they do? If you know that, and then you have an excess of them, you'll know what's going to happen. If you know that and you have a deficit of them, you know what's more than likely going to happen, which would lead to you would know the symptoms and an appropriate assessment. You'll know the treatments. What are we going to do for too much of any of these or not enough? And then the nursing care while experiencing electrolyte disease or treatment. Eventually, you'll connect the acid-base balance with the fluid deficit or overload with diseases and electrolyte movement in and out of the cell. And you're going to put all of that into the nursing process. And what does that do for you? Quite simply, the nursing process, you're going to be able to problem solve, and you're going to be able to help the patient manage their way through diseases that cause an alteration in electrolytes. Okay, I'm sure you have many questions. You can bring them, and I will see you next time.